Welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you for joining us once again. Our guest is Dr. Damon Reed. He's lead investigator for the National Pediatric Cancer Foundation. And in our ongoing series with the foundation, he's joining us to talk about an initiative called the Sunshine Project. And I'll let Dr. Reed give us a bit of background about himself, and we'll talk about this initiative and more about the National Pediatric Cancer Foundation. Thank you for joining us today, Dr. Reed.
Thank you for having me, Neil.
Well, you're involved in cancer research. What is your background? Where are you practicing, and what are you doing?
I work mostly at Moffitt Cancer Center in Tampa, and also work at Johns Hopkins All Children's Hospital in St. Petersburg. I take care of young patients, children and young adults with a particularly devastating type of cancer called sarcoma, which is a rare tumor, which hasn't had much success over the years. And so I've kind of worked feverishly towards trying to bring new ideas and new treatment strategies to these patients.
Now, every year in September, it's Childhood Cancer Awareness Month, and you're a lead investigator for the National Pediatric Cancer Foundation's initiative called the Sunshine Project. What is this project all about, and how is your foundation working to kind of fast-track pediatric cancer research?
Good, excellent question. So the National Pediatric Cancer Foundation's Sunshine Project is a group of over 20 hospitals now that are like-minded individuals who are kind of tired of what we've been doing and trying to figure out new ways to get ideas into patients to improve their outcomes. I've been working with this for about 10 years, since 2008, and the National Pediatric Cancer Foundation has been around a bit longer than that, over 25 years. I will say we've shamelessly as investigators, as MDs, we've shamelessly followed the lead of a mother, Melissa Helms, the founder of the National Pediatric Cancer Foundation, who's really mandated that we think outside the walls of our own institutions and work together, that we bring the best ideas, and that she would do the legwork along with the board and the foundation to bring the funds to enable us to do things. And so it's really been wonderful to be able to gather thought leaders from around the country and to not be in a system that is kind of restrictive and where no is the default, but rather enabled by the National Pediatric Cancer Foundation to do things we think rather nimbly, swiftly, and innovatively.
Now, as I said, we've been talking with other folks from the NPCF about childhood cancer, some of the lack of funding, how some of the rarer of these cancers are almost seem to be not looked at all. When it comes to the development of new drugs, dealing with how toxic these drugs are, the availability, what is the foundation doing, this Sunshine Project doing to kind of fast track some of these less toxic, more targeted treatments for pediatric cancer?
Excellent. So I've been speaking mostly conceptually, but I can get real concrete real quick. And so there are two latest trials that have opened up, one in around April and the other in July, are good examples of this. So we have a trial called ACTION, which is led by an investigator at University of Florida, Dwayne Mitchell, very talented investigator who is training the immune system to fight a devastating form of pediatric brain tumor called high-grade glioma. You're right, this tumor is rare enough and understudied enough, in part because of funding, that there is not even a standard way to treat it successfully when patients are newly diagnosed. Nevertheless, and sometimes cancers have a good treatment up front, and when they come back, we're at a loss. But this is a cancer that we don't have a good upfront treatment for. And so ACTION, the trial developed with preclinical funding from National Pediatric Cancer Foundation and building on a very successful Mitchell lab, actually takes out the immune system of patients and trains it to fight that patient's particular cancer, that high-grade glioma. And so it's a very exciting trial that the National Pediatric Cancer Foundation has funded. A second example over the past few months is we have an agent also partially developed by preclinical funding by the National Pediatric Cancer Foundation called SP2577, or its commercial name is seclidemstat. And this is an agent that has been investigated at the University at Utah, at the Huntsman Cancer Center, by an investigator in part funded by the National Pediatric Cancer Foundation. And this agent is, while it has some promise in many cancers, it is really remarkable that the company has chosen to start with the first patients having Ewing sarcoma. I know they're very rare, but also very devastating cancer. And so the first patient to receive this drug was started about 2.5 weeks ago. And rather than the old model where a drug that is targeted gets used in a much more common cancer, even if it doesn't seem to have a huge signal of activity there, in this case, the activity really is in Ewing sarcoma. And so the company was innovative enough to work with us to start in a rare population that is Ewing sarcoma. And the trial is only for Ewing sarcoma patients. The first time anyone's ever taken this medicine on Earth. And so this agent is touted. We don't know yet because it hasn't been given to enough people. It's only been given to one. But it is touted to be much less toxic than what we normally give Ewing sarcoma patients, and it has a good biologic rationale for why it would work in Ewing sarcoma patients.
You know, when it comes to getting folks involved, getting awareness about the need for funding and involvement in this research, you mentioned how a drug can be used even though it's not showing any real activity with that particular type of cancer, but because it was successful in another type, there's a maybe kind of thing, that shotgun effect going on. Talk to our listeners about the high level of importance given to targeted treatments, especially for pediatric cancers. I mean, you know, kids have got the rest of their lives to live once they beat a particular type of cancer. Talk about the importance of targeted treatments so as not to waste time with others.
Good. The pediatric cancer is 1% of all cancers. It is rare, and it is not the same as adult cancers. And so there's a couple parts of that question to address. So one of them is I'm not one to point a finger and blame some other group that's involved in the cancer, the fight against cancer, and to say they're doing something wrong. So a company is fundamentally trying to get a drug to sell it, and so they do look for the biggest market that they can find. That makes sense. And if I worked for a company, I would probably do the same thing. But what has been particularly devastating about that business decision is that we would need a drug to work for a different kind of cancer than a pediatric cancer to have enough legs for us to study it in pediatric cancers. And so the drug would have to be kind of almost like a unicorn. It would have to be something that works successfully in, say, breast or lung cancer, but also works in a pediatric cancer, which is completely different than a breast or lung cancer. So we've been hamstrung a bit in the pediatric world by that. Groups like the National Pediatric Cancer Foundation, Sunshine Project, bring some funding and a well-oiled machine to study agents, such that an agent that might be interesting in a pediatric cancer can just be studied in that pediatric cancer, rather than have to run through and be successful in an adult cancer in order to even have a chance of being studied in the pediatric cancer, which is the traditional model, which is still ongoing to this day. So we're trying to disrupt that model a little bit by getting these drugs to the right patient to try to find a signal of activity sooner, even if it is in a smaller population. And drug companies are getting wise to this too. I mean, if they have the FDA has been wonderful as well lately. If a drug has an activity in a cancer, why go for a bigger market where it has less of a signal? Mm-hmm. Your second part of the question, which is also excellent, is yes, of course, we would rather have. I think it is a great idea to have agents that are less toxic and more targeted for a specific patient's cancer in all patients. But in particular, the drugs that we use for children have devastating side effects 10, 20 years down the road that we accept right now because there's no better alternative. If I'm sitting across from a patient now and the alternative, the treatment is very toxic or the cancer kills the patient, we choose the very toxic treatment. But we would love, and that's part of our mission, is to bring less toxic treatment so that the patients are doing better, not only in 2018, but also in 2038.
Give our listeners a website where we can learn more about the NPCF and learn more about Childhood Cancer Awareness Month, and possibly guide us in getting involved in the effort against childhood cancer.
Our website is nationalpcf.org, and we have tons of information about events that are very fun to participate in, our research, other ways to participate in our mission in the Sunshine Project. Cancer.gov is a wonderful resource for objective cancer information made by the National Institutes of Health. But please feel free to reach out to our organization. We're very happy to advocate for these children with cancer and to again work as a wonderful multidisciplinary team of parents, concerned citizens, and scientists to bring the best treatment to these patients.
Thank you so much for joining us today, Dr. Reed. I'm hoping we can talk again.
I hope so too. Thank you so much, Neil. This is great.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.